We have 3 plenary lectures lined up. First one will be done by Dr. Shanika Karunaratne. He's a consultant cardiologist attached to District General Hospital, Polonnaruwa. He will talk to us on a very important topic, which is relevant to these days: challenges in providing cardiac care in the COVID era. Over to you, Shanika.
Very good morning to you all. And today we are in the second half of the symposium, and my part of the lecture is to describe you the challenges in providing cardiac care in the COVID era. So during the next 15 minutes, I would like to introduce where we stand as a country in this COVID pandemic and what are the inpatient and outpatient cardiology services in Sri Lanka and the impact of COVID-19 to the cardiac care in Sri Lanka. And I would describe the basics in COVID-19 protection guidance for the healthcare workers. And I would try to discuss the challenges in main 4 areas of interest, which is how to deliver the cardiac care, how to triage it, and how to prioritize these procedures, and ultimately how to protect yourself and your patients. And hopefully you will take home some messages. So remember at this part of the lecture, 4 things and the challenges pertaining to it: cardiac care, triage, prioritization, and protection. So we know that COVID-19 has reached a global pandemic level. And we know that cardiovascular disease have a higher rate of adverse outcomes when they get COVID-19 infection. And already cardiovascular diseases are the world's biggest killer. You can see on the right-hand side of your slide that the highest mortality is related to the cardiovascular deaths, which is nearly 18 million per year. So this CTPP, or cardiac care, how to triage it, prioritize it, and protect it, is quite a challenging thing in a COVID pandemic. So this is the latest Sri Lankan statistics of COVID-19 infection. You could see that nearly 540,000 were confirmed up to date, and we have 13,706 deaths as per today data. So when it really comes to the pandemic level, we had 3 waves of the COVID pandemic. You could see that the first wave and the second wave, we didn't have much of a death. But when you really compare the third wave, you could see that out of that 13,000 deaths so far, 12,302 happened during the third wave. So you could see that with each wave pattern, our mortality or case fatality rate increases, adding the burden to all of us, all the healthcare workers, to fight with it. So when to deliver the cardiac care, it becomes more challenging. So why COVID has such deaths? You know that mainly it's due to the cardiac complications and lung complications. So when it comes to the COVID pathophysiology, the virus itself is damaging to the cardiac muscles, and it induces or trigger a cytokine storm. So this cytokine storm is detrimental to the myocardium and the heart, so that you have an array of complications. You could get swelling of the heart and the pericardium, called myopericarditis. And the patient could get a heart attack, which could be a bit of a thrombotic type. We call it type 1 MI. And sometimes supply-demand mismatch, which is the type 2 MI. And they could get arrhythmias. And sometimes you may hear some of the patients died suddenly with sudden cardiac death in their homes. And also we should be vigilant about cardiac toxicity of the antiviral drugs we use for these treatment. So some of the antiviral drugs could potentially cause cardiac toxicity. And very rarely, vaccination itself could cause a cardiac effect. So when it comes to this cardiac care delivery, healthcare worker has a lot of challenges. So we will try to discuss one by one by remembering this short form of CTPP. So out of that, C is care, T is triage, P is prioritization, and last P is protection. So how to give the care, how to triage it, how to prioritize it, and how to protect it. So what are the cardiac care settings which is challenging in Sri Lankan setting? So we have 7 cardiac care settings, which we all know: the outpatient setting or the OPD settings, ward setting, emergency setting or A&E, and CCU and ICCU settings. And we sometimes have catheterization laboratories and electrophysiology laboratories in some centers. And there are high-risk aerosol generating procedures also, which all of you should be vigilant of. So remember, out of the care, there are 7 challenging areas to deliver the cardiac care. Out of that, outpatient setting has sub-services, which we have another 7 sub-services. So you all know that we have specialist clinic, or very commonly called as CC clinic, general clinics, and we have echocardiography services, exercise ECG service, dobutamine stress echo service, and 24-hour studies like Holter and ambulatory DP studies, and non-invasive imaging arms like CT coronary angiogram and MRI are part of the outpatient setting. So you could see that it is very challenging as we have multiple arms to deliver in a pandemic setting, even in an outpatient setting, to minimize the risk of contamination or infection with corona. Remember, there are a few high-risk aerosol generating procedures. We all know that the transesophageal echo, continuous positive airway pressure or CPAP, or emergency intubations all carry risk of aerosol generation, risking the healthcare worker. So this makes us all should be aware of the protection mechanisms. So we have level 1, 2, 3 levels of protection. We all know that there are different types of mask, where the FFP3 is the ideal, which we don't have in Sri Lanka, but FFP2 and N95 is readily available, and the surgical mask has a bit less protection. And there are PAPR system or powered air purifying respirator systems available in Sri Lankan setting as well, if you really don't want to change the PPE kit, so that in this system you can continuously wear from morning to evening. So level 1 protection is usually for the patient, you only wear a fluid resistant surgical mask. But when it comes to the level 2 protection, we all practice in most of the circumstances. You add a face shield, disposable apron, and a glove. But level 3 protection is in an emergency situation where you add an eye protection and a long sleeve fluid repellent gown and an outer glove and an inner glove to facilitate the level 3 protection. So we have discussed the challenges in cardiac care, and then it comes the T or triage, how to triage these patients. So we have to take universal precautions to provide appropriate masks to all the patients and the healthcare workers, and a common triage checklist. That means, now we know that, corona is everywhere, so we don't have any district or high-risk areas. What we have to ask is whether they have real symptoms of upper respiratory infections or a contact history, or very typical symptoms like loss of smell and upper respiratory symptoms when it comes to the triage list. And we should avoid overcrowding. So the healthcare workers, especially the nursing officers, should be vigilant to take them clusters by clusters, giving their time appointments to avoid overcrowding. And sometimes some of the procedures may need a pre-test for COVID with rapid antigen test. So these outpatient procedures are quite challenging. Now, we know that patients should have level 1 protection with a mask. Usual healthcare workers should have level 2 protection, as I discussed earlier. And some of the investigations like transesophageal echo, Holter, exercise ECG, we usually tend to do a rapid antigen test and perform it if the pandemic level is very high, like level 3 or level 4. But we are always understaffed. That is the most challenging thing. And overcrowding, as you can see in the clinic, and lack of patient database is a real problem, because we can't send digital e-prescription for these patients because the database and the drugs are not updated and their addresses are not good. And we have drug shortages and some logistic issues like postal delays. So outpatient procedures are really challenging to minimize risk. When it comes to the ward setting, it is the same scenario, but we have to have a dedicated isolation area, because some of the pandemic times, the patient can flood into the ward setting so that the whole staff and the patients can mix together. So always have a dedicated isolation area planned in your ward by the nursing officers and the staff, and dedicated medical equipment to the COVID suspected patient, not to mix with the normal patients. And always there are overcrowding and lack of isolation spaces, lack of COVID test kits, and lack of PPEs, which is a challenging setting for the healthcare worker. And always remember, the common restrooms for the staff is also we should avoid, because most of these sporadic staff positive cases, when we trace back, they were together in a common restroom, spreading the infection to their colleagues. So always be vigilant to avoid that. When it comes to the prioritization, or the third part of the challenge, how to prioritize these cardiac procedures. Now, it's a simple remembering way is when you have a green light, it is a very light pandemic level or level 1, where you could do all the procedures. But when it comes to the pandemic level 3, we call it amber level, we may have to delay some of the procedures beyond 3 months. But when it comes to the red or pandemic level 4, where the whole district and the whole country is infected, including the healthcare workers, infection risk increasing time, then we might have to stick only for the emergencies and urgent procedures. So you could see that in a pandemic level 4 or severe level of pandemic, you could only do emergency and urgent cardiac care. And when it comes to ST elevation MIs, which you all should know, it is a quite challenging thing. Now, usually the door to balloon time or the procedural time should be within 60 minutes. But in COVID pandemic, they have given more time for the ST elevation MI to act, so that 2 hours or 120 minutes time is given to transfer them to a cath lab. So if your patient is able to transfer to a cath lab for primary PCI, you have 2 hours. But if you can't do it within that time, you have to discuss with the team to thrombolize the patient. And the final part is the protection, donning and doffing. Donning is the, getting into the PPE kit, and doffing is getting out of the PPE kits. So remember, when it comes to the donning or taking in, it's always head to hand. So that means you wash hands and then put the disposable cap to the head, and then the mask, then the inner gloves, then the protection clothing, and then the outer gloves. Doffing is the reverse of that, where you remove the outer gown, glove, then the gown, and at the end, you remove the outer glove. So it is a reverse way of donning, where all the healthcare workers should be vigilant of. So we have seen most of them doing this wrong. So always remember, first cap, then mask, then the inner glove, and then the surgical kit, and then the outer glove to put in the kit. So this comes to our end of the short lecture, where I have introduced the Sri Lankan story and what are the outpatient and inpatient cardiology services in Sri Lanka. And I have explained you the challenges to remember it in a very easy way, to remember the CTPP, or how to deliver the care, the challenges in regard to it. Then how to triage it in an outpatient and inpatient setting, and how to prioritize these in the level of pandemic, where you might have to divide it into red, amber, and green. And finally, the protection method, where the donning and doffing we should all be vigilant of. So if we stick to our basic principles of CTPP and know the basics, I think we can do a better cardiac care amidst the COVID pandemic, and we could triage them well, we could prioritize the urgent ones versus non-urgent ones, and we could protect the patients and, most importantly, our own staff to protect from COVID and cardiac illnesses. So this comes to the end of our lecture to deliver the cardiac care challenges amidst the COVID pandemic. And I think I make this opportunity to thank you all in fighting COVID and delivering the cardiac care for the poor patients. And I make this opportunity to further thank SLCC to giving me this opportunity to deliver this lecture to educate you all. And I think we are ahead of the time, and if time permits, I'm happy to answer any of your questions at this moment. But if a time is a limiting factor, we would give you opportunity to do a question and answer session at the end of all 3 lectures. Thank you very much.
Thank you, Shanika. Thank you for that excellent lecture on challenges in COVID cardiac care during this COVID pandemic. You explained the important areas and what are the challenges we are facing and how to handle that. Thank you so much. But unfortunately, we cannot allow the questions because it's a plenary. So let's move on to the second one.